Jasmine, an African-American woman, took an extraordinary step toward her peace of mind by secretly recording her own surgery. Expecting to capture standard medical procedures and dialogue, she wanted to understand every aspect of her operation. The recording device hidden under her pillow was her silent guardian in the operating room. But as she played back the recording, Jasmine's blood ran cold at the words she heard. She simply couldn't believe it at first, and she rewound the recording to listen to it one more time. There was no doubt about it. She knew for sure that the doctor had never intended for anyone else to hear this, as it could get him into serious trouble. The longer she thought about it, the more she realized that she needed to do something. This was very serious, and she couldn't simply let that doctor get away with it. No, he needed to suffer the consequences of his actions. She would make sure of that. She didn't care if it would get him fired or not. However, she didn't want to do it alone. With a trembling voice, she showed the recording to her husband, knowing that he would help her think of a plan. But what did Jasmine hear? Why did it upset her so much? And what was she going to do about it? But before we start our story, smash the like button, make sure to subscribe, and hit the notifications bell so you won't miss any new stories. Everything will be okay, honey, I promise. Jasmine's husband, Chris, told her as they packed her things. She was going to the hospital tomorrow to get surgery, and she had been quite nervous about the whole thing. She had only been to a hospital a couple of times in her life, and it had always been to visit someone else who was staying there. Of course, Chris's words helped a little, but they did not completely remove Jasmine's fear. So she had taken matters into her own hands and looked for different ways to become less scared. She had read some tips online, and she had finally found a rather unusual way to make the whole experience more interesting than scary. She was going to secretly record the procedure. Jasmine hoped that hearing everything the doctors talked about during the procedure would make it seem more natural, and she wouldn't be as scared if she ever needed to undergo surgery again. This idea had made her quite curious, and she had actually started looking forward to analyzing the audio afterwards, which definitely helped with her nerves. She wondered if it would be like Grey's Anatomy. Would she be able to understand what they were saying, or would they only speak in difficult medical terms? She thought about it for a long time, and she imagined various scenarios, but not even once did she think of the shocking things that the doctors would actually end up saying during her surgery. Anyway, as the days passed, Jasmine bought a little recording device that was perfect for this plan. She hadn't told Chris about it yet because she wanted it to be her own little project, but she would definitely show him the footage after the surgery was done. The night before her surgery, she sneakily put the recorder into her bag without him seeing it. The next morning, Chris drove her to the hospital and waited with her until she needed to enter the pre-op room. He would have gone inside with her if he could, but only patients were allowed past that point. Chris left for work in the meantime since he'd have to wait a couple of hours, but he promised that he would be back once Jasmine was free to leave. So, Jasmine said goodbye and entered the pre-op, where a nurse greeted her. Nurse Emily led her to her bed and explained some last things about the procedure. She also handed Jasmine a hospital gown and showed her where she could store her clothes. Jasmine felt the fear slowly bubbling up again, and she took a deep breath to calm herself down. "It will be okay," she whispered. Jasmine slipped into the stark white hospital gown, feeling a chill as the fabric brushed her skin. The locker clicked shut, sealing away her clothes and worries, if only for a moment. She glanced around the sterile room, its beeps and hums a stark contrast to her racing thoughts. "It's just a routine procedure," she reminded herself, trying to push away the nagging doubts. Dr. Roberts entered the room with a smile that didn't quite reach his eyes. He spoke of the surgery's simplicity, his words a rehearsed melody meant to soothe. Jasmine listened, nodding at intervals, but her mind latched onto the uncertainty behind his confidence. As he left, her heart held onto a sliver of reassurance, but the seed of doubt remained firmly planted. Grabbing her phone, Jasmine's fingers flew over the keys, sending a message to Chris affirming all was well. Sending it felt like throwing a lifeline into the vast sea of her anxieties. She imagined his smile and the way he'd say her name, and for a fleeting moment, she felt less alone in the cold, impersonal room. The wait stretched on, each tick of the clock a reminder of the impending procedure. Jasmine turned to her phone, immersing herself in games, the digital victories a temporary escape. Yet, beneath the surface of each win, her mind whirled, caught between the fear of what was to come and the hope for relief. As the minutes slipped by, Jasmine's nerves frayed. She replayed Dr. Roberts' words, clung to Chris's digital reassurances, and lost herself in the mindless flicker of her phone screen. Yet, the unease lingered, a shadow at the edge of her thoughts. However, the thing keeping her afloat was the recording she was planning to make, her curiosity more powerful than her fear. A new face appeared, the anesthesiologist. He came in with a clipboard in hand and a calm demeanor. He introduced himself with a gentle voice and dived straight into the evaluation. Jasmine listened, trying to mirror his calmness, absorbing every word as if it were a lifeline thrown to her in this sea of uncertainty. He explained the anesthesia process, his words painting a picture of a peaceful sleep from which she would wake with no memory of the procedure. "It's like a deep, restful nap," he said, attempting to ease her fears. For a moment, Jasmine felt the heavy cloak of her anxiety lighten, the concept of sleep offering a brief respite from her worries. Despite the reassurance, the butterflies in her stomach performed a relentless dance. Never before had she been put under, and the idea was as alien as it was frightening. Yet, as the anesthesiologist's explanations took root, Jasmine found a newfound readiness. "I can do this," she silently affirmed, clinging to the shards of bravery within. Suddenly, the room seemed to shift into high gear. Nurse Emily's voice, clear and kind, announced, "It's time." Heart pounding, Jasmine nodded, a sense of surrealism washing over her. This was it. She was on the verge of a journey she'd pondered and fretted over for weeks, the moment of truth now just a breath away. With the nurse's attention elsewhere, Jasmine's fingers wrapped around the small recording device, its presence giving her a stronger emotion than her fear. Slipping it under her pillow, a silent rebellion against her fears, she felt a spark of defiance ignite within. This little device was her bridge to understanding, her silent witness in a room where she would be asleep, oblivious to the world around her. As Jasmine entered the operating room, her eyes darted around, absorbing every detail. The room was filled with equipment she'd only seen on TV, and despite her situation, she found it fascinating. The bright lights, the organized chaos of preparations, it all felt strangely captivating, a distraction from the nervous flutter in her heart. The medication from the anesthesiologist flowed through Jasmine like a calming tide, softening her anxiety into a mellow stillness. Her body eased into relaxation, her thoughts drifting like clouds across a quiet sky. As the doctor's voice signaled it was time, Jasmine's final conscious act was to check under her pillow. Her fingers grazed the recording device hidden there, her silent ally. A flicker of resolve surfaced. The blur of lights and voices dissolved completely, leaving nothing but silence. When Jasmine awoke, it was to soft beeping and hushed voices. The surgery was over. A nurse appeared with a smile, confirming its success. Relief surged through her, but her body, heavy and uncooperative, pulled her back into sleep before she could even celebrate. Her next awakening came more clearly. The haze was lifting. Her fingers instinctively reached beneath the pillow, and there it was, the recorder. A breath of relief escaped her lips. It hadn't moved. Her mind buzzed with anticipation. What had been said while she was unconscious? The device held the truth. A knock interrupted her thoughts. Chris walked in with flowers and a comforting smile. Their brief exchange was enough to soothe her nerves, even if he didn't know her true reason for requesting the laptop and earphones he'd brought. After he left, the room grew still again. Jasmine retrieved the recorder with care, her hands slightly trembling. She reached for her laptop. With the recorder connected and earbuds in place, she hovered over the play button. The recording began. Sounds of being wheeled into the operating room echoed in her ears, the mechanical clatter, muffled voices, medical jargon. This wasn't about the surgery anymore. It was about what happened when they thought she couldn't hear. As the doctor's voice cut through the background noise, Jasmine tensed. She was about to revisit the moment her awareness faded. The surgical team's clinical chatter filled her ears, but a few minutes in, her attention snapped to unexpected words. She rewound, replayed, and confirmed what she heard. A quiet reference to a mix-up, followed by, "Let's just call it a rare complication." Shock settled over her. Had a mistake been made? Was it being covered up? She didn't act right away. Instead, she tried to process what she'd discovered. The next morning, Chris immediately noticed something was off. Jasmine shared the secret of the recording. When he listened, his expression darkened. Before they could talk further, a doctor entered, checking on another patient, Mark. Later, Mark stirred, and Jasmine reached out to him. In their brief conversation, he casually mentioned a rare complication. Jasmine and Chris exchanged a knowing look. The coincidence was too much to ignore. Hearing Mark's story brought a wave of empathy. They weren't just roommates in recovery, they were tied by a thread of medical negligence. They knew they had to act. With quiet determination, they requested a meeting with the chief medical officer. Jasmine played the recording. The atmosphere was tense as every word echoed through the room. When it ended, the officer thanked her, and she felt, for the first time, a sense of justice. The fallout came swiftly. The doctor involved was dismissed, and others complicit faced consequences. The hospital took a stand, addressing what had been hidden. After her discharge, Jasmine felt drawn back to visit Mark. Their friendship, born in silence and uncertainty, became a source of strength. As Mark healed, the hospital acknowledged its error and provided him the care and recognition he deserved. In time, their hospital gowns gave way to normal clothes and ordinary days. But Jasmine and Mark's friendship remained, a lasting connection forged in one of life's most unexpected places. Together they moved forward, not as patients, but as people who found truth, healing, and each other when they least expected it.